Dear friends, I am Dr. Thompson Akwo Ntuba, international physician, international political leader, international communicator, certified professional expert in global health USA, sub-specialized in global health communication, or what we call medcom, medical communication. So I want to share with you some insights and updates from the meeting that we had today with the Director General of the World Health Organization, Dr. Tedros, out of Geneva. The discussions were done under COVID-19, the humanitarian situation and crisis in Syria, in Yemen, and also the pox virus. It is said that there seemed to be an increased resurgence or number of COVID-19 infections around the world, about 30% increase. And that this is particularly happening more in the continent of Europe, though it is said that that is seen in almost all the regions, with one of the major drivers being the reduction of testing, which is also affecting the global health preventive measures which are in place. And the world, nations are advised to look at these issues and address them nationally vis-a-vis their own national strategic plans of preparedness and response against COVID-19. The problem of inequity is still there. Vaccinations are still very, very low, especially in LMICs, so what are called the low and middle income countries, the LMICs, or the LMICS nations, or the low and middle income countries. So vaccinations against COVID in some of these low and medium income countries has not reached, or it's not reaching the 70% estimates by June, July that the WHO expect by 2022. That notwithstanding, countries are being told to increase their level of preparedness, make sure that the most vulnerable are vaccinated to a very high level. We are talking about the elderly, people who are in their 60s and above. They may not compromise. Healthcare workers, so that there can be an acceptable level of control of COVID-19 around the world. With the issue of inequity, the problem of the technologies, we know that the ACT accelerator was put in place, then the COVAX. But some of these instruments are not actually delivering the results which were necessary. As Dr. Tedros said, when the ACT accelerator was put in place, there was the understanding that there were the issues of inequity. So the nations and leaders around the world who brought up the idea had two goals in mind to have the medical commodities, technologies, be it diagnostics, test, therapeutics, and all of the others, vaccines, will be available fast enough. And then when they were available, they were going to be equitably distributed so that access will not be hindered by affordability issues. Because today, access could be hindered by availability. But in the early phase, when the problem was we don't have enough vaccine, there was the issue of access, being hindered a little bit because there was this competition when the supply was very limited and demand was very high. But today there is vaccine, but the problem that is limiting, it's contributing to the limitation in access is affordability. So there is the question and there is the need for the vaccine manufacturers and the rich countries or advanced countries, as they say, to work with the World Trade Organization and make sure that patency issues are addressed so that some of these vaccines, the generics or whatever, the therapeutics and all of those, they are generic and other forms can be produced in LMCs or low and middle income countries. So those issues were addressed and there are initiatives which are put in place at the level of the World Health Organization to address them. And so far, even though there are people like Dr. Bruce, who think that the global health experts around the world have failed the world, Dr. Tedros believes that unlike HIV/AIDS, when it took about 10 years for the therapeutics, antiretrovirals, which were produced in the advanced countries to reach the third world, from around December 2000, when some of these health commodities related to the control and fight against COVID-19 were produced in advanced countries, it took a very short time. By February 2021, as he said, most of these commodities were already, in Africa, in other parts, in the Eastern Mediterranean, Eastern Europe, South American nations, working with PAO and all the other regional agencies of the World Health Organization. So there is a belief that things have improved, things are getting better. The humanitarian situation in Yemen, in Syria, and those other places are also a problem. And even Ethiopia, the Tigray area, because of Ethiopian government and Eritrea, there are problems, with humanitarian assistance, especially drugs, food, and related issues are being hindered to be delivered. So the world is called upon to contribute more. In terms of the pox virus, there is still an increase in new cases, especially in Europe. The drivers of it are addressed. There is, as the Center for Disease Control in the USA, CDC, has shown some of the drivers and risk factors people having sex men by men. The LGBT community is encouraged to come forward and work with the global health experts around the world to see that mitigating measures, are properly put in place to address most of these issues. So the sequencing is being done around the world, at the level of the United States. The CDC is working with the US government and doing more and enough to see that vaccines are available, and people who are at high risk, that is people who have had contacts with those who are infected. It's not like COVID that you are just going to give everybody vaccines. That's not it. This is not a very easily transmitted infectious agent. You need contact, skin to skin contact or something like that with the infected and affected. So there is the issue of contact tracing, and you looking at those who are susceptible and vulnerable, and trying to strategically direct and tailor your vaccination towards them. So the experts are doing what is required of them, and all is going well. So there is going to be the adjustments of the Act Accelerator. It's not phasing out. They are just going to make sure that they adjust things here and there, because there have been the question of, is it coming to an end? No, it's supposed to be phased out so that they can adapt it to the realities of different countries and vis-a-vis what is going on, so that Gavi, the Global Fund, and all the other initiatives and funds and bodies that are taking care of global health issues can also do their job. So the World Health Organization is doing a great job in that area, and things are falling in place. And